good. Here we go. Hey, Matt, you might want to be on mute.
Oh, I'm sorry.
It's okay. There we go. So we have HB 811, HB 931, and HB 945, and all three of the bill sponsors are here. Why don't we start with Delegate Hill's HB 931, Healthcare Facilities, Nursing Homes, Medical Director Requirements. Lisa, please explain the bill.
This bill requires a physician designated to serve as medical director of a nursing home to meet specified requirements and obtain a specified certification on or before a specified date. The Maryland Department of Health may grant a physician a time-limited extension for obtaining a medical director certification on a showing of good cause. The bill also removes the requirement for the Secretary of Health in consultation with specified stakeholders to establish qualifications for a nursing home medical director or anyone acting in their absence, and requires MDH to adopt specified regulations. The amendments that have been distributed, and there are two separate amendments. One of them strikes a provision that would have prohibited a physician from being a designated medical director at more than 2 licensed nursing homes. And the other amendment moves from September 30th, 2028 to September 30th, 2030, the date by which designated medical directors are required to obtain certification. And that amendment also replaces the requirement that the Department of Health maintain a directory of medical directors with a requirement that nursing homes post specified information related to medical directors on the nursing home's website.
Thank you. Dr. Delegate Hill, sponsor of the bill. Any comments on the amendment?
No, I think Ms. Simpson did a standout job of explaining the amendments. The amendments should bring everybody to a good place, and the advocates would like some time to actually do a study on their own to figure out, possibly based on bed capacity, is there an appropriate limit to how many facilities a medical director should be supervising. We clearly have a problem now getting good qualified medical directors, so we don't want to put more strains on the system. But we think that getting the certification, which hopefully was understood from the question and answers in the committee, is not a certificate, but it's actually coursework that gives a certification of, as was explained, all the things that are become important to do that are different from just your medical training, that we think that will improve the quality and the patient outcomes and also be more cost effective overall. So with that, I would ask that you all consider both amendments and move the bill. Thank you.
Sure. Any comments from advocates before I open the floor for a motion?
We're comfortable with the amendments, and we thank Delegate Hill for working with us.
Perfect. Lovely. Thank you, Dana.
And
All
I
right.
also agree the same.
Wonderful. Thank you. Good to see you, Doctor, a fellow GW revolutionary. All right. Any motions on the bill?
Oh, I'm on the committee. I can move the bill. I move the amendments.
I'll move the amendments, excuse me.
I move both amendments together.
Second, Delegate Martinez. Motion on the bill.
Oh, we didn't vote the amendments?
Oh, I'm sorry. What am I doing? I'm going too fast. All right. Everyone in favor of the amendments indicate by a yellow hand or an eye.
Aye.
There we go. Delegate Morgan is here. I'll follow up with him. Perfect. No abstentions. No.
Matt, Delegate Morgan's waving his hand.
Okay, there we go. Perfect. Thank you for keeping me honest twice this voting session, Delegate Hill. All right, there we go.
Now I can move the bill as
Amendments
amended.
passed. Yes, bill as amended. Any motions?
I move the bill as amended.
Okay.
Second, Delegate Martinez. All right, all those in favor say aye or indicate with the yellow hand.
Aye.
There we go, and the bill passes. Thank you.
Thank you.
And thank you, Delegate Hill.
Thank you,
All
Ms.
right.
President.
All right, Delegate Wallach's bill HB 811, Aging in Place Programs, Grants, Multi-Generational Third Places, the Village Multi-Generational Third Places Act. Delegate Wallach. Go for it, Lisa.
This bill authorizes the Maryland Department of Aging to make grants to nonprofit organizations and area agencies on aging to support social connection for individuals in aging in place programs through events or gathers at multi-generational third places. The bill codifies the authorization for any nonprofit organization or area agency on aging to apply to the department for a state grant to be applied toward operational costs, including administrative costs or short-term or long-term leases or rental costs for a senior village to provide access to generational third places. And there are no amendments.
Thank you, Lisa. And Delegate Wallach, anything to share on the bill as the sponsor?
Not much more to add than what was in the hearing. The bill essentially, there's an aging in place provision, which there's a set of criteria towards which aging in place grants can be made. There's a set of 7. We're adding a number 8 in terms of eligibility. So villages would then be, if this bill passes, eligible to apply for funding for these longer term third place use. So it is simply adding an eligibility for villages to be able to seek those monies. And that's it.
I'd like to move the bill.
All right, is there a second?
Second.
All right, all those in favor, say aye or indicate with the yellow hand.
Aye.
There we go. Any nays? No, all right, the bill passes. Thank you, Delegate Wallach.
Thank you.
Sure, all right. Our last one, HB 945. Lisa, take it away.
This bill requires the Maryland Department of Health, when investigating a nursing home complaint alleging actual harm or immediate jeopardy to a resident, to notify the local health department for the county in which the nursing home is located. To the extent practicable, MDH must consult and coordinate with the local health officer on the complaint investigation and response. There were a couple of different amendments that were distributed. The first one was a result of testimony during the bill hearing, and the Delegate Sample Hughes and I worked on. And that amendment requires notice to the local health departments within 24 hours of initiating the investigation rather than immediately. It clarifies that consulting and coordinating with local health departments is required as permitted under federal law, and specifies that the new provisions may not be construed to require local health departments to assist the department or otherwise assume the responsibilities of the department in nursing home investigations.
Thank you, Lisa. So just so we're clear, there's 2 sets of amendments here. One, as you indicated, that you drafted came from the result of testimony that we heard in the hearing, and those are supported by the sponsor of the bill. And then we have other amendments that have been offered by MDH that are not sponsored by or not supported by the sponsor of the bill. And so Delegate Sample Hughes, help make it make sense. What's going on with this bill?
Sure. So, good afternoon, everybody. The amendment that I had put in when we met and presented the bill dealt with the word immediately. And so in meeting with Department of Health, they had concern about that. So I made that change and made sure that it was going to be at the initiation of a investigation to happen, that the health department or health officer would be notified within 24 hours. I thought that was fair, and that addressed the immediately issue. The other portion of the amendment, they spoke about making certain that they were aware of communicable diseases and things of that nature. But that's all, is my understanding, that's already done now by health departments and the health officers being notified and understanding that when there are communicable diseases, that they're already a part of the process. So that wouldn't be anything new, any new notification. And so therefore, that was where I was sharing with the bill drafter that that's not anything new that's coming to the table. Again, the concern has been, is just that at least at the local level, there would be the health officer aware of when complaints are lodged, and they have the consultation ability to have that conversation if there are resources within the local jurisdiction.
Sure, thank you. Any comments from the advocates or from MDH?
Sure. Good morning, Delegate Lopez, Chair Lopez, and Delegate Sample Hughes. Appreciate the time here. I think, Delegate, we are good with the amendments that you proposed about striking it immediate. I think we were ships passing in the night on that second piece, right? But Lisa was kind enough to share with me the reprint yesterday, so we're fine with the draft, and we appreciate your consideration and our meeting before the bill hearing.
Perfect.
I'd
Anyone
like to
else?
I'd like to move the amendments, at least for discussion. Quick question.
Thank you. Is there a second?
Second.
All right. All those in favor of the sponsor
I have a
amendments?
question.
Go for it, Delegate Hill.
I have a question.
Go
Okay,
ahead.
so Delegate Sample Hughes, Montgomery County Department of Health, they wanted to clarify that this does not create a new obligation for local health departments to assume responsibilities of the Department of Nursing Home oversight, and instead offers local departments the ability to gain information and access to the department's work in nursing homes in each county. I don't think that these amendments address that. Is there a need to address that, or have you addressed that?
Thank you, Delegate Hill. So they are under a different umbrella because they have their own oversight of their, actually, well, one day I would love to go there and be similar to Montgomery County. But I wanted to start at the point of there be some documented notification, and not looking for them to do a whole lot of extra work, but just be notified and be aware of when, again, their local resources within the jurisdiction to be able to share those with the nursing home. It's pretty much a conversation, and not to take on additional, they have to take on the complaints. That still rests with the state. That doesn't change at all. It's just that they should be able to have those local conversations to identify resources to assist the nursing home when we identify that there obviously has been a complaint.
Okay.
Delegate Hill,
Yes.
sorry, if I can
I
just
was
real
about to
quick.
ask you if there's a need for anything, or it's clear. Thank you,
Sure.
Elise.
So there is some language that's added on page 2 that nothing in this paragraph may be construed to require a local health department to assist or otherwise assume the nursing home oversight responsibilities of the department as required by federal or state law. It doesn't specify that what, like, that it should be
Right,
for
but it's nothing shall
information.
be construed as, and that takes care of that concern.
But that was trying to, yes, that
Perfect.
was trying to address.
Okay, thank you. Those are my questions, and they've been answered. Thank you.
Thank you, Delegate Hill. I should clarify to the subcommittee that the goal of this meeting today is to move the sponsor amendments, but we will not be voting on this bill in its entirety because there's still some amendments that are pending. So to offer it up for conversation to the group, and just to do a deeper dive that we might not have addressed everyone's concerns or questions in the hearing.
Can I ask, are there, so these amendments that we've discussed today aren't sufficient? Can I ask them what are the other amendments that are being considered?
Sure, absolutely. So I would say broadly, this bill presents an opportunity to be a vehicle to talk about other ways OHCQ could be strengthened in its surveying of complaints and issues. And so we're trying to think of how to use this bill fully to its true, potential of accomplishing some broader goals. And I've talked to Delegate Sample Hughes about where we're comfortable doing with that and where some obvious issues are. So I think it would be I would be kind of like getting ahead of my skis a little bit to go into too much detail because we are waiting for MDH to provide a broader amendment, and I can't speak on their behalf because we haven't had that conversation yet. Delegate Hutchinson.
Thank you, Madam Chair. So are we looking at, I like the bill and I like the intent of the bill because we have issues at the nursing homes. But are we looking at this bill then as that holy grail to address all those issues that we have with nursing homes, or is this just still a component of it? Like when you say more amendments are coming, are we trying to build this bill as the nursing home oversight bill issues that we've seen in terms of us not having enough teeth to go in and change behavior and improvement in the nursing home? Or
Yeah, well, I'm cautious of using the term holy grail for anything, but
Yeah.
I do think that it moves us closer to that mark. And I am mindful of the clock. And so, I think as much as we can take advantage of this great piece of foundational legislation that Cherie Sample Hughes has given us, the better off we'll be. So we don't want to rush it along. We want to take as much reasonable time as we can, given the clock, to be thoughtful about how to use this as a vehicle. So I guess the lawyerly answer would be, it depends, but yes, we're getting there.
Great.
Thank you.
Yeah. And so this would be an opportune time for folks in the advocacy community or MDH, if you feel like sharing anything about more amendments you might be interested in, or follow-ups to hearings that you want to use this opportunity to explain a bit more. We have a few more minutes before we do a switcheroo.
And we have a motion on the table.
Oh, that's right.
I can be brief here and
Oh,
thank
go
the
for it.
subcommittee. Thank you, Delegate Megan Lynch with the department, to thank the subcommittee for the thoughtfulness around, I think, discussions on OHCQ. Please know that we are in conversations, certainly with the governor's office on some ideas here, and we will be in touch as soon as possible. And I know, Delegate, you and I have texted a little bit, but yeah, without intending to sound too cryptic, right? We just need a bit more time to sort out a few things on the back end, but we appreciate the subcommittee's thoughtfulness here and your partnership on this, and certainly Delegate Sample Hughes as well.
Thank you, Megan. I would say sometimes people respond well when you give them specific deadlines. I would say if you can get us language to review by Monday, then we can prepare perhaps for a subcommittee meeting a little bit earlier so we can make the voting list and get there on time. Yeah, and similarly, if there's other folks who have thoughts about amendments, now's that time. Right, so we've had a motion. Was there a second on the amendments?
Yes.
Right, all right, all those in favor indicate with a hand or an eye. Right, there we go. Any opposed? I'm gonna assume that's a lingering, yeah, there we go. All right, the amendments passed, thank you. All right, any other questions or concerns for the good of the order? No?
Move for
All,
adjourn.
all right, thank you. We are adjourning. See ya.
Thank you, Madam Chair. Thank you.
Thank you.